I understand that you're here for a pulmonary function test today.
Yeah.
Okay. So you're having some troubles breathing, and you'd want me to assess the overall lung capacity and the quality of your breath.
Yeah, I've had a bit of shortness of breath and a bit of tightness when I breathe.
Okay. Have you been sick lately?
No.
No?
I don't think so.
Okay, so no particular reason why you would be feeling these symptoms. Okay, sounds good. So we can definitely take a look at what's going on with you today. I'm actually going to be using a device that is specifically designed to measure your lung capacity and how much volume of air you can breathe in at once. This is called the spirometer, and it's going to allow me to measure the quality of your breath. It has a mouthpiece, and you're going to take a deep breath in from here. As you breathe in, this piston is going to move up, and it's going to measure how much air goes in your lungs. As the piston moves up, this indicator here will also move, and you will want to keep this in between these two lines over here. If this indicator moves above the blue line, then you're taking in too fast, you're taking air in too fast. And if it moves below, then you're breathing in too slowly. So deep breath in, move the piston up, and try to keep these in between these two lines. And we're gonna see how much air you can take in and whether your lungs are functioning at an optimal capacity or not. Okay? And if I do find out that, for some reason your lungs are not functioning at optimal capacity, I have a couple of exercises that we can do together here. And you can take this home and practice on your own and increase that capacity on your own over time.
That sounds good.
Okay, very good. Before we begin that exam, I want to review a couple of questions with you just to make sure that nothing else is going on that may lead me to reach to a different diagnosis. Okay, so have you had any shortness of breath? Okay, so and when did this start happening for you?
A couple of days ago.
Okay, and has it been consistent or on and off?
Yeah, it's been consistent.
Okay. Have you felt any wheezing while you're breathing? Okay. Any persistent cough?
No.
Have you been diagnosed with pneumonia recently?
No.
Okay. Have you had any chronic pulmonary diseases? COPD? No? Good. Any history of cystic fibrosis with you or anybody in your family? Sickle cell anemia? Asthma?
No.
Allergies?
Yeah, some allergies in the spring.
Seasonal allergies, okay. Any history of pulmonary fibrosis?
No.
Chronic bronchitis?
No.
Okay. And have you had any recent surgeries that I should be aware of?
No.
Okay. Very good. So the reason why I'm asking these questions is, because any one of these conditions could contribute to a decreased lung capacity. So it's good that there doesn't seem to be any systemic reason why you'd be feeling what you're feeling. Okay? So we'll start off by taking your vital signs first, and then we'll move into the pulmonary function test using the spirometer that I just showed you.
Okay, that sounds good, Dr. Lux.
I'll start by putting my gloves on first.
Okay.
So I'll quickly take your vital signs to make sure that we have a good baseline to compare your future assessments against.
Okay.
Okay. Quickly take your temperature over the forehead. 98.5. That is a very good temperature. Let's check your level of oxygenation. Your index finger. Okay, let's give this 10 seconds. Try to relax. 8, 7, 6, 5, 4, 3, 2, 1. Okay. I'm actually seeing 91% oxygenation, so that's on the low side. Definitely, you're most likely not taking in as deep of a breath as we would want. So let me make a note of that, and let's see if we can bring that level of oxygenation up through a couple of breathing exercises.
Okay. I have felt a bit fatigued lately.
Bit fatigued, okay? That can be a side effect of not getting enough air. Okay. Let me quickly take your blood pressure as well. Okay, let's slide this in. Your blood pressure is 120/60. That is a very good blood pressure. Okay, that's a good indication. Okay, and I will quickly listen to your heart and your lungs, front and back.
Okay.
So I'm definitely hearing normal heart sounds, no murmurs. I'm gonna listen with the bell side as well. I'm hearing S1 and S2. Not hearing S3 and S4. Definitely normal heart sounds, no signs of heart failure or any abnormalities with your heart muscle. Okay?
That's good.
Yeah. Okay, I will listen to your lungs next. Take deep breaths in for me and out. In and out. In and out. And deep breath in and out. Okay, no wheezing, all normal sounds coming from your lungs. And you indicated that you're not a smoker, correct?
That's right.
Let me quickly listen in the back as well. Deep breath in and out. In and out. No murmurs, no whooshing or swishing. Your lungs sound perfectly normal. Okay. So your lungs are definitely healthy, James. No signs of any abnormal sounds coming from them, or anything that's a major red flag as of right now. Okay, let me quickly summarize these observations. Normal temperature, normal blood pressure 120/60, 91% oxygenation. We're going to work on that in a minute. Normal heart sounds and lungs. Okay. Okay, James, we're going to move into the lung capacity assessment portion of our visit today. We're going to use the spirometer. Like I mentioned, I want you to take deep breaths. When you put this mouthpiece in your mouth, make sure that it makes a good tight seal. And I want you to take deep breaths and to relax. And first exhale out all of the air in your lungs. Make a tight seal. Breathe in slowly. Don't rush. And bring the piston up as much as you can while keeping this indicator in between these two lines here. Okay, we'll first get the baseline of where you are, so how much air goes in your lungs in the first try, and then we'll work at bringing that up.
Okay.
Okay.
Can I hold it from here?
Yes.
Okay.
Exhale out at first. Okay, so your baseline is at 2200 milliliters. Okay, that's a bit on the low end. Let me make a note of that. 220 ml. Usually for healthy males of your age, we would want to see at least 3000 milliliters of air volume being, inhaled. So let's leave this indicator here. That's your baseline, and let's see if you can bring that up in a couple of tries. I definitely noticed that when you're breathing in with the top of your body, with your chest. I want you to try to breathe in using your abdominal muscles. Mm-hmm. So imagine your belly like it's a balloon and you're trying to expand it while breathing inside. Okay. So try to use those abdominal muscles to inflate your belly when you're taking that deep breath in.
Okay.
Okay, so that went up to 2500. Could you feel the difference between breathing in with your chest?
Yeah, I could actually.
And breathing in
I'm
with
not
your...
used to that, but it definitely helps.
Okay. It's called diaphragmatic breathing. Okay, very good.
Yeah, I feel some tightness, I think, around here.
Okay. Do you feel any dizziness?
Maybe a little lightheaded. Not too much.
Okay.
My muscle hurts. I think that's why I can't breathe in so deep.
Okay. If you feel any dizziness, I'd want you to stop and relax for a bit.
Okay.
Usually, I want my patients to, take at least 5 to 10 rounds and see where we are after the 10th attempt.
Okay.
Take a deep breath in. Exhale all the way down. Okay, now put the mouthpiece in your mouth. Tight seal. Breathe in slowly. Keeping the piston in between those two lines. Okay, that was good. So we're getting closer to 3,000 milliliters, which is very good. Okay. Almost 3,000 again. So you're getting really close to that 3,000 mark, which tells me that you definitely have the lung capacity. We just need to work on improving your breath and your overall intake of air. And it looks like you're making progress, so let's continue with a couple more exercises.
Okay. That's good.
Very good. So you definitely surpassed the 3,000 mark, which is the baseline for a healthy male of your age. I'm definitely not seeing any indication of something systemically wrong with your lungs. I do want to perform a nose exam as well, just to make sure that the outside of your nose works well and that there's nothing, no inflammation or anything wrong with your nose. But as of right now, judging by the sounds that I was able to listen with my stethoscope from your lungs, you seem to be healthy. And the tightness of breath could be, because maybe you've not been exercising as much as you probably could.
Yeah, work has been hard.
Okay. How often do you exercise in a week?
Maybe once, maybe less.
Okay. So definitely 2 to 3 times exercising during the week can help you bring some air into your lungs, circulate the blood, and oxygenate your body. Would you like to try another exercise?
Yeah.
Okay. Okay, breathe out all the way. And then breathe in. Slow and steady. Fill your abdominal cavity with air. Okay. That's very good. Let's try again, and again try not to move your chest. So don't inflate your chest, but inflate your belly.
Okay.
All the way out. Oh, look at that. Over 3,500. That's excellent, James.
Thank you. Dr. Lux.
So definitely the lung capacity is there. After a couple of exercises right now, you're above the optimal level. So I do recommend that you take this device home and that you try to do the same exercises twice a day for a couple of days in a row. 10 minutes in the morning, 10 minutes in the evening. It's going to help your lungs expand and bring in more air to your whole body, relax you before you're going to bed, and increase that oxygenation that you need so that you can continue to be able to take deep breaths in all the time.
Okay, that does feel better already.
Okay.
I can feel.
How are you sleeping at night? Do you fall asleep fast?
Yeah, sometimes it takes me maybe half an hour or 45 minutes. That's a little longer than I would like.
Okay. So this can definitely help relax you right before bed. Breathing exercises can always put you in a positive mood, can help your mind, clear out all the confusion, all the stress of the day, and help you fall asleep faster.
I can be confused sometimes.
Yes.
Okay, Dr. Lux. Thank you.
Do you want to try a couple more times?
Yes.
So you are at 3,500 now. Let's see if you can do a 4,000. That's usually optimal. Almost there. That's perfect. $4,000. Okay, James, that was very well done. I was definitely able to see that you increased your breath capacity from below 3,000 mLs to almost 4,000 mL. So that's very good.
That's good.
Are you feeling okay right now? Dizzy, lighthearted?
No.
No?
A little lightheaded.
Okay, very good. Before we started doing the breathing exercises, we saw that your oxygenation was at 91%. Mm-hmm. I'd like to measure it again and see where we are right now.
Okay.
Okay, let's give this 10 seconds. 7, 8, 9, 10. Okay. So I see that we are at 98%, which is optimal oxygenation. Okay.
That's good. It really helped.
Yes. Yes. Let me quickly summarize. So we did about 7 to 10 exercises, and we were able to bring your oxygenation level up from 91 to 98%. Normal pulmonary function. You did very well with the spirometer.
Thank you, Dr. Lux.
So good news is that you're able to increase your breath capacity, your lung pulmonary function looks okay to me. I will perform a quick nose exam to make sure that the outside of your nose is healthy and there's no inflammation or anything wrong with the outside of your nose. Okay, please have your glasses. Okay. I will start by just palpating the outside of your nose. Let me know if you feel any pain or tenderness.
Okay.
Your sinuses are not swollen. The bridge of your nose is straight. Your sinuses are okay. I'm not feeling any bumps or lumps in your nose. Do you feel any pain right now?
No.
Okay. Does this hurt?
No.
This?
No.
Okay, very good. Okay, I'll quickly take a look inside both of your nostrils. Have you noticed a decrease in your sense of smell at all?
A little bit.
A little bit, okay.
But I thought it's allergies.
Allergies, okay, that could be it. You can please look up for me and just relax. No redness, no inflammation in your right nostril. No discharge. Okay, that looks perfectly healthy. Let me see the left one as well. No redness, no inflammation, no discharge. Normal color. No sign of anything wrong. Yeah, so your nose is perfectly healthy inside. You can take your glasses back.
Thank you.
And let's make sure you can smell within normal. Can you please tell me what this is?
Coffee.
Coffee, okay, very good. So your nose works perfectly well.
It's strong coffee.
Yes. Okay, James, so definitely I was not able to find, anything wrong with you. Your lungs are healthy. Your lung capacity, we were able to improve it. Same with your oxygenation levels. Healthy nose on the outside. I do want you to take this home.
Okay.
And like we discussed, use it in the morning, use it in the evening, 10 to 15 minutes, 7 to 10 different exercises, deep breaths in. It should improve your overall oxygenation and lung capacity within a couple of weeks.
Okay.
Okay?
Thank you.
Do come back to see me within 2 to 3 weeks, and we can do the same exercises again and see where your lung capacity is after performing the exercises that I mentioned. And I hope you can sleep better at night as a result of this as well.
Thank you, Dr. Lux.
Okay, very nice seeing you again.
Nice seeing you.